Hi, I'm Dr. Desiree Edlin, Clinic Director for OC Back and Body Doctors. Over the last 13 years in practice, I've had thousands of patients come in, many of them very afraid to be adjusted by a chiropractor. One of the most common questions I get is the adjustment painful, or what are the risk factors of getting adjusted? Well, first of all, in my office, the adjustments I can say are definitely not painful. In fact, we do such a thorough evaluation up front, which includes nervous system scan testing as well as digitized x-rays, that we make sure that you are a candidate for chiropractic care. Because some people are not, and if that is the situation, we refer those patients out to the appropriate healthcare professional. But if you are, the types of adjustments that we do here range, and we use a variety of different techniques based on what you need and what you want. Some of them may be hands-on adjustments that are very gentle, and others we may use instrument adjusting where you don't hear any popping or cracking noises. Now, the risk factors involved with an adjustment is very, very low. In fact, the risk of you actually getting hurt by a chiropractic adjustment is 1 in 4 million. And that's a statistic taken from the malpractice insurance carriers. Something I always tell my patients as well is the chiropractic malpractice insurance is about $2,000 to $3,000 per year. Now, in the medical profession, it could be anywhere from $10,000 to $100,000 per year. Insurance companies are smart. They know their risk factors. So to answer your question, is chiropractic safe? Is chiropractic safe? Absolutely. Chiropractic is very safe.
My name's Tim Olarts. I'm Whittier, California. About 7 years ago, I woke up in the middle of the night with this excruciating pain in my ankle, and lasted, I don't know, a minute or so, and shut off and didn't think too much about it. Went back to bed, and a couple days later, it happened again and started to become more frequent and more intense. So I started this journey of trying to figure out what was going on. Started with my family doctor. I ended up at various institutions like USC, UCLA, Scripps. Some people thought it was in my ankle, others decided it might be in my back, so I ended up at LA Spine Center and Presbyterian Spine Center, and after seeing, I think it was 33 different doctors, which included podiatrists and orthopedic surgeons and spine specialists and neurologists and neurosurgeons, after 5 surgeries on my ankle, which produced nothing. So then we, started the drug therapies, the Lyrica and Cymbalta and Neurontin, and none of those did any good. None of the pain medications did any good. Things like Vicodin, useless. Even Demerol and morphine, none of it but did anything. Ended up in every emergency room for a 20-mile radius over the years, and then when all else failed, we ended up on the antidepressants and several different types of those, and to try to help me cope with what they couldn't diagnose. I had a couple of doctors just simply suggest it was all psychological and that I needed some psychiatric help. And I began to think so myself. I actually saw a couple of psychiatrists and psychologists. Obviously got to the point where I couldn't work, couldn't function at all. Started to affect not only me, of course, but my family too. And got to the point where I knew that I couldn't go on this way. This thing went on for about 6 years, and I had tried to figure out what would be the most efficient way to do away with myself, and what would be the easiest and least painful for everybody. I mean, it got to that point where I seriously considered that. And then a friend of mine recommended OC Back and Body. I came here and saw Dr. Edlin, my first interview. So we started my treatment here, and it was a combination of adjustments and therapy in the gym and laser treatments. She decided that she was going to concentrate on my lower back. So I started the treatments here after, I think it was, no, I know it was the 12th treatment. And only had a couple to go, and I wasn't really planning on sticking it out. I remember Dr. Edlin saying, though, something to the effect of, what do you got better to do with your time? So I decided to stick it out a little bit. Anyway, after the 12th treatment, I remember waking up the next morning and sleeping all night, and the thing generally hit me while I was sleeping, so that was strange to sleep all night. And then I was coming in here 3 times a week. Then the next day I slept through and came in for another treatment the next day, and the next day, and then 1 turned into 10, and 10 turned into 20, and at that point I decided to just do whatever she told me to do. So I kept my treatments up, but it was obviously doing something for me, because for the first time in 6 years I was pain-free. I got off all the drugs. I started tapering off all the pain medications, the nerve medications, the antidepressants, and all of those things. I started stopped taking those just as quickly as the doctors would allow me to. And then kind of for fun, we started using the laser on the keloids and the scars that were left behind on my ankle from all those unnecessary surgeries. And that was something we could actually see. That was a visual that that gave me an idea what might be going on inside my back. All of those scars and lumps and bumps and adhesions just started to melt away on my ankle. So I haven't just experienced improvement. This thing has cured my problem. It has cured my problem. It's not better, it's gone. And I've sent several letters to several of the doctors that I'd seen before, and talked to some of them too. And pretty much, with the exception of my family doctor, the rest of them just dismiss it, really. And they're missing out on something that they need to pay attention to, because I'm living proof. Like I say, I know there's a couple of doctors that I could tell are fascinated by it, but they don't really want to ask, other than my family doctor, who has promised me that he's going to look into everything I've told him because he's fascinated by it. So anyway, if it wasn't for Dr. Edlin and her team here, I wouldn't be here today. The treatment here literally saved my life.